This recording is the muscular system, part 1 of 4. Skeletal muscles attach to bones, and the two bones joined by the muscle have different functions. The site of attachment on the area of the bone that does not move when a muscle contracts is referred to as the origin. That is the stationary or fixed point of attachment. The site that moves when contraction occurs is referred to as the insertion. The insertion is the movable bone. Usually the origin lies proximal to the insertion. However, sometimes with muscles, they may change their function depending on the muscle. We'll see that later. The insertion is generally pulled toward the origin, and muscles cross joints. Joints are the movable part of the skeleton. My humerus itself does not have motion within it. However, the joint proximal to the humerus, which is my shoulder joint, and the joint distal to the humerus, which is my elbow joint, are movable joints. So motion always occurs at joints. Muscles can only pull, they can never push. Whenever we contract our muscles or move, there has to be a coordinated, concerted effort by lots of different muscles to cause efficient motion. When motion occurs, there's usually a muscle that is going to cause the majority of a specific motion. The muscle that's responsible for causing the majority of motion is referred to as the prime mover or agonist. When I flex my elbow, there's a muscle deep to biceps brachii called brachialis. Brachialis only crosses the elbow joint and is known as the prime mover or agonist for elbow flexion. Biceps brachii is a synergist. It helps brachialis do its job. However, biceps brachii crosses two joints. It crosses the elbow joint and the shoulder joint. Therefore, it is a synergist aiding the prime mover in motion. Some synergists have the additional responsibility of stabilizing the origin of the prime mover or maintaining posture in our bodies. Those synergists have the additional title of being fixators. Fixators stabilize or fix a joint in place to help the prime mover do its job more efficiently. If a prime mover moves a joint in one direction, remember that the prime mover is also called an agonist. The antagonist will move the joint in the opposite direction. These names are relative according to the motion. If my motion is elbow extension, then triceps brachii is my prime mover or agonist. If my prime motion or main motion is elbow extension, then brachialis and biceps brachii become my antagonists. Let's do that again. If elbow flexion is the motion, that's caused by the agonist brachialis and synergist biceps brachii. That means that the antagonist is going to be triceps brachii, which causes extension. Again, it's all relative. I'm going to give you guys a real quick hint about motion, and I think I do this in some of the videos where I talk about motion. The muscles anteriorly tend to flex the body up to the hip joint, or I should say from the top down to the hip joint. Things anteriorly are going to cause flexion. However, from the hip down, those muscles anteriorly tend to cause extension. So let's do that again. From the top of my head to my hips, everything anteriorly causes flexion, and the muscles in the back of my body cause extension or hyperextension. From my hip downward, muscles anteriorly will cause extension, and muscles posteriorly will cause flexion. This will help you as you're studying muscles, especially the muscles of the forearm. Think about this. I'm going to move this down. Okay. If I'm flexing my wrist, all these muscles anteriorly are going to be flexors. If I'm extending my wrist, then the muscles posteriorly are going to cause extension. Again, that simple tip will help you when you are studying these structures. Here we have a picture of elbow flexion, and they flipped it around, unfortunately. They did it incorrectly. They're showing biceps brachii as a prime mover and brachialis as a synergist. Technically, brachialis is the workhorse for elbow flexion. It is the prime mover. It is the agonist. Please keep that in mind for me, for my tests. Sometimes books start changing things, and they do that when they go through different editions. It's not technically correct. So please know that for me, brachialis is a prime mover, biceps brachii is a synergist. Here we have brachioradialis also as being a synergist in elbow flexion. Brachioradialis is a synergist in helping elbow flexion when the elbow is in what's called a semi-pronated position. So if you are lifting up a cup, then you're in a semi-pronated position. So remember, this is supination, this is pronation, here's semi-pronation. We already talked about how muscles are put together. Let's do a quick little review. Each little individual muscle fiber that formed from hundreds of myoblasts fusing together to make it a long, striated, voluntary, multinucleated muscle fiber having the membrane known as the sarcolemma wrapped in endomysium. Remember, we put those muscle fibers together to make a structure called a fascicle. Fascicles are bundles of skeletal muscle fibers that are wrapped together in perimysium. We see perimysium here. And then bundles of fascicles wrapped together are going to be encased by dense irregular connective tissue called epimysium. The prefix epi means above, so the epimysium is above everything in the muscle. And all of this dense irregular connective tissue blends together and starts to have a regular pattern, which forms dense regular connective tissue, in this case in the form of a tendon joining the muscle to the periosteum of the bone. The tendons, the aponeuroses, whenever any kind of connective tissue attaches to the bone, it's actually attaching to the periosteum of the bone. The patterns of the organization of the fascicles can be seen whenever you look at a muscle model in lab. You see these lines in the skeletal muscles, and those are actually the fascicles. And these are arranged in different patterns. Sometimes the patterns will help you understand the names of the muscles. The shapes of muscles and the alignment of their fibers helps to determine the force and the motion with which they will contract. And if we look at the different types of shapes of muscles, we'll see that circular muscles often carry the name Orbicularis with them. There are some muscles that have a broad origin, and then they converge to form a single tendon. Those are referred to as convergent. We have some muscles that are shaped like feathers that often attach in an oblique fashion. Oblique means at an angle. Here we have a unipennate muscle, a bipennate muscle, and the word penna means feather. Here we have the multipennate muscle that you know as deltoid. Other muscles have fibers, muscle fibers, fascicles, that will run in a parallel fashion, but then they kind of fuse at either end. This is a parallel fusiform muscle, and others have fascicles that run parallel to one another, but they don't fuse. They have flat bands of attachment on either end, such as is the case with Sartorius. Muscles can be named in many different ways. Sometimes they're named according to their location. For instance, temporalis is located right over the temporal bone. Intercostals are located in between the ribs. Sometimes muscles are named according to their shape. The deltoid muscle is shaped like the Greek letter delta. Trapezius is shaped like a trapezoid. Sometimes they're named according to their size. If the muscle carries the name maximus, it's very big. If it's minimus, it's small. Longus is long, brevis is short. Sometimes muscles are named in accordance with the direction of their fibers. Rectus muscles are muscles that have fibers that run straight, usually straight up and down. Transversus muscles run across the body, and oblique muscles go at an angle. Sometimes muscles are named according to the number of origins. For instance, biceps means there are 2 heads or 2 origins. Triceps means 3 heads or 3 origins. Quadriceps means 4 heads or 4 origins. Sometimes muscles are named in accordance with the location of the attachments of the muscle. Sternocleidomastoid has an attachment at the sternum, an attachment at the clavicle, as well as an attachment at the mastoid process of the temporal bone. Sometimes muscles are named in accordance with their action. Remember that from the hip up, most of the muscles, not all, most of the muscles anteriorly are flexors. Most of the muscles posteriorly are extensors. Muscles that move body parts in towards the midline, crossing it, are adductors. Think of adding things together, whereas muscles that move body parts away are abductors. Where would your extensor carpi radialis longus be? Well, carpi means wrist. Extensors from the hip up are on the posterior aspect of the body, and we know that the radial pulse is always taken close to the thumb. So the bone radius is lateral, the ulna is medial. So extensor carpi radialis longus is going to be on the posterior lateral surface of the forearm. If we look at how muscles are named, we see that there are a lot of Latin roots that are put together. For instance, just looking at the word abductor. Ab is a prefix that means away from. Duct means to move. So the meaning of the word abductor is a muscle that moves away from. In anatomy and physiology, we say away from the midline. The word digiti comes from the Latin root that means digit, and this refers to a finger or a toe. And then minimi comes from the Latin root minimus, which means mini or tiny. So we're talking about the little toe or little finger, pinky toe, pinky finger. So abductor digiti minimi would be the muscle that moves the little toe or finger away from midline. And then we can do the same thing with adductor digiti minimi. This is a picture of anterior and posterior muscles of the body. The pictures that you see here are showing superficial layers of muscles. As we move forward in this slide presentation, you may see a picture where one side of the body being presented looks different than the other side. It's very common for illustrators to have a superficial side and a deep side because muscles come in layers. So pay attention to what might be the superficial presentation and what might be the deep presentation. Usually the superficial presentation will have more fascia, more connective tissue showing than the deeper presentation. Muscles of facial expression are important because they help us express emotion. Different types of emotion like fear, anger, happiness, sadness, surprise are expressed because these muscles of facial expression insert into the dermis of the skin. These muscles are innervated by one of 12 cranial nerves called cranial nerve 7, which is the facial nerve. Here we have a picture of a woman who is experiencing paralysis of facial muscles on one side of her face, which is known as Bell's palsy. Bell's palsy is a temporary type of facial paralysis that usually resolves fairly quickly and fairly completely. This is not true in all cases of Bell's palsy. However, it is true in many cases of Bell's palsy. We're going to take a look at some of the muscles involved in facial expression, starting with Epicranius, which is also known as Occipitofrontalis. Occipitofrontalis is named so because it has an occipital belly. The belly is the thick portion of a muscle. The occipital belly is located near the occiput. There's also a frontal belly of Occipitofrontalis right over the frontal bone. These two muscle portions are connected by the epicranial. Remember the prefix epi means above, cranial, above the cranium, aponeurosis. The epicranial aponeurosis is a flat band of dense regular connective tissue connecting these two muscle bellies together. The action is to elevate the eyebrows. This is sometimes referred to as the surprise muscle. Another muscle of facial expression is Orbicularis oris. Oris means pertaining to the mouth. The origin of this muscle is the dermis around the lips, and the insertion is the corners of the mouth. The action of this muscle is to close or purse and protrude the lips and helps shape the lips during speech. Sometimes this is referred to as the kissing muscle. This takes us to Zygomaticus major and minor. Remember the Zygomaticus bones, the cheekbones? That's where this muscle originates, on the zygomatic bone, and it inserts at the corners of the mouth. Normally, when you see the terms major and minor with regard to muscles, an easy way to remember them is the minor is usually the more superior and smaller of the two, and the major is the more inferior and larger of the two. The action of Zygomaticus minor and major is smiling and snarling. A snarl is half a smile. Next we have Depressor anguli oris. This muscle appears like a triangle. And the origin of this muscle is the mandible. The insertion is the dermis at the corners of the mouth. The action is frowning, opening the mouth, and sliding the jaw slightly from left to right. The next muscle we're going to discuss is Buccinator, which originates on the maxilla-mandible and sphenoid bone and inserts on Orbicularis oris. The action for Buccinator is to compress the cheeks while whistling, blowing, sucking, or any kind of lateral movements of the cheek that may occur. Please, when you see all these different origins and insertions listed, understand that for a test, I will only ask you about origins and insertions if it's something I think you should be able to figure out by the name of the muscle. For instance, Sternocleidomastoid. Sternum, cleido means clavicle, mastoid is the mastoid process of the temporal bone. Coracobrachialis, coracoid process of the scapula. Brachia means arm, humerus. Okay, those things you should be able to figure out. So I may ask you on those, but something like this would be very difficult to try to memorize, so I'm not going to ask you to do that. Here we have Orbicularis oculi. Orbicularis oculi is another orbital circular muscle. There's actually two different portions. The orbital part goes around the actual bony orbit of the eye, and then there is a palpebral part that makes up the eyelids, upper and lower. I'm not going to ask you about those, by the way, I'm just pointing them out. However, you should be able to easily identify Orbicularis oculi. The origin for Orbicularis oculi is the medial bones of the orbit of the skull. The insertion is the circumference of the orbit. The action of Orbicularis oculi is to close the eye or blink or squint. There are 6 extrinsic eye muscles that move your eyes in different directions. We can move our eyes to the side, laterally, or medially, up, down, at angles. There are 6 extrinsic eye muscles. We have one that is straight on the top of the eyeball, and that is the superior rectus muscle. We have one that is at the bottom of the eyeball, and that is inferior rectus. We have 2 that are at an angle, superior oblique and inferior oblique, and 2 that are on the sides. We have a medial rectus muscle and a lateral rectus muscle. Now you'll notice superior rectus and inferior rectus are attached at the top and the bottom of the eyeball in a slightly medial fashion, because this is where medial rectus is, so that is medial, this is lateral. And that is why when superior rectus contracts, it's going to move the eye superiorly and slightly medially. When inferior rectus contracts, it's going to move the eyeball inferiorly and slightly medially. Medial rectus moves the eyeball medially. Lateral rectus moves the eyeball laterally. As far as superior and inferior oblique, they're going to do a little bit of the opposite of what the name says. Superior oblique actually moves the eye downward and laterally, where inferior oblique moves the eye upward and slightly laterally. Here we have these muscles, and you can see the superior oblique muscle actually runs through a little ligament here that makes up the trochlea. Remember, the word trochlea means pulley. And that's why when this muscle contracts, it's going to act on moving the eyeball down and laterally, inferiorly and laterally, whereas inferior oblique moves the eye superiorly and laterally. Here's inferior oblique. It attaches at an angle. That's why they're named oblique muscles, because of the angle at which they attach. Here we have superior rectus, lateral rectus, which has been cut over here. This guy right here is medial rectus. And then we have the inferior rectus down here. So 6 extrinsic eye muscles. The medial rectus and lateral rectus are pretty easy. They just go straight medially or straight laterally. Superior rectus is superior, slightly medial. Inferior rectus is inferior, slightly medial. The superior oblique moves the eyeball inferiorly and laterally, and inferior oblique moves the eye superiorly and laterally. The next muscles are referred to as muscles of mastication, which is the process of chewing. We're going to begin with masseter. Masseter is the strongest muscle relative to its size. Here we have a picture of the masseter muscle. You can see its origin is on the maxilla and zygomatic arch, and the insertion is at the angle of the mandible. The action is to elevate the mandible. So when I close my jaw, that's elevation of the mandible. You can also, if you put your hands on your cheeks, just underneath the zygomatic arch, and clench your teeth, you can feel the masseter muscle. I'm going to disappear for a second. And here we have a model with the masseter muscle. This is a prime mover, and again, its action is to elevate the mandible. The next muscle of mastication we're going to discuss is temporalis. Temporalis was named because it's found right over the temporal bone in the temporal fossa. It inserts on the coronoid process of the mandible, that's that pointy part of the mandible, and its action is to elevate and slightly retract the mandible. It is a source of pain sometimes. When the muscle gets tight, it can actually cause tension headaches. The next muscles of mastication we're going to discuss are the pterygoids. There are medial and lateral pterygoid muscles. The medial pterygoid muscles originate on the sphenoid, maxilla, and palatine bones and insert on the medial surface of the mandible. So their action is to close the mouth, protract the mandible, and move the mandible side to side, which is referred to as lateral excursion. The lateral pterygoids originate on the sphenoid bone and insert on the mandibular condyle. The action of the lateral pterygoids is to open the mouth and protract the mandible, as well as move the mandible from side to side, which is lateral excursion. When you look at these muscles in the lab, I always used to tell my students the laterals lay down. See how the medial pterygoids tend to run a little bit more superior to inferior, whereas the laterals kind of run anterior to posterior a little bit more. So the laterals lay down. That's how you can distinguish between the two, lateral versus medial. Next, we're going to discuss muscles of swallowing, starting with the digastric muscle. Digastric means two bellies. Gastro means belly, di means two. Remember, the muscle belly is the thick portion of the muscle. The digastric muscle has an anterior belly and a posterior belly. If we look at the picture at the bottom, you can see the anterior belly of the digastric muscle begins at the mandible and goes through a tendinous sling on the hyoid bone, continuing as the posterior belly, which attaches to the posterior aspect of the mastoid process of the temporal bone. Sometimes origins and insertions switch depending on what part of the body is fixed or stable. And sometimes if one portion is fixed, the other part can move, and vice versa. This is the case with the digastric muscle. It can either depress the mandible or elevate the larynx. Remember, your larynx is your voice box. The next muscle we're going to discuss is mylohyoid. The mylohyoid muscle goes from the mandible to the hyoid bone. Here we can see the mylohyoid muscle. The mylohyoid muscle elevates the hyoid bone and the floor of the mouth when swallowing, or it can depress the mandible. The next muscle we're going to look at is sternocleidomastoid. Sternocleidomastoid originates on the sternum and the clavicle and inserts on the mastoid process of the temporal bone. When sternocleidomastoid works on both sides bilaterally, it causes flexion of the neck. If just one side of sternocleidomastoid contracts, it will laterally flex the neck and rotate the head away from the side that's contracting. So both sides, neck flexion, unilaterally, lateral flexion, rotation in the opposite direction. This is a prime mover in neck flexion and is very commonly a muscle involved in torticollis or whiplash.